Dr. Jewel Kling. Today we're talking about a study that's coming out in the Mayo Clinic Proceedings in 2019 entitled Menopause Management Knowledge in Postgraduate Family Medicine, Internal Medicine, Obstetrics, and Gynecology Residents, a Cross-Sectional Study. And in this study, we surveyed 20 different programs in internal medicine, family medicine, and obstetrics and gynecology across the U.S. to look at their knowledge of menopause as well as their exposure or education in their residency programs. We designed a survey based on a previous survey that had been done on providers to assess their knowledge of menopause medicine. And so we adapted it for residents, and then we distribute it via email to people at multiple different sites. We did provide an incentive, the Menopause Solution Book, which is a Mayo Clinic menopause guide, as an educational tool so that the residents could have something if they completed the survey to kind of close that loop and help fill the gaps that maybe they demonstrated in the survey results. Our knowledge of menopause practice and safety of hormones have evolved since the Women's Health Initiative came out in the 2000s, which was a big random control study that found some unexpected risks related to hormones. And a lot of providers and women kind of stepped away from using hormones. But updated analyses of different studies and further random control studies demonstrate the safety of hormones early in menopause. But what some studies have shown is there's been a lag in women getting access to that treatment, and we expect some of that lag may be lack of education in residency programs. We found that all three types of residents, internal medicine, family medicine, and obstetrics and gynecology residents, are all interested in menopause and think it's important. They answered many of the knowledge questions correctly, but there were a few important knowledge gaps. For example, approximately 34% of the participants would not offer hormone therapy to a woman that was significantly symptomatic with hot flashes and night sweats and didn't have any contraindications to hormones. Similarly, about 39% of the residents would not offer hormones to a woman that goes through premature menopause until the average age of menopause. Now, this is an important finding because more and more data shows that women that go through menopause early have increased rates of certain chronic diseases if they don't get hormones until the average age of menopause. So it's important for our residents to know when they're getting out to clinical practice to get that treatment to women that need it. What we're proposing is that any primary care provider, internal medicine, family medicine, obstetrics and gynecology that are at the front line taking care of women should have the skill set and the knowledge to be able to treat women that go through menopause. The projected numbers of midlife women are something of 50 million by 2020, and about 75 to 80% of women develop symptoms of menopause. So we need all of us at the front line, internal medicine, family medicine, obstetrics and gynecology, all of us to be prepared and knowledgeable to manage the symptoms of menopause. Well, I think the important aspects of the study for patients is that, first of all, we see that these residents understand that menopause management or knowledge is important, which would suggest to me that they're interested in learning more. With the gaps that we've identified, this can provide some information to residency programs moving forward so we can figure out how to fill those gaps so that we are prepared when those future millions of women that are coming in that are symptomatic, we can help manage their menopause and improve their quality of life. So when women go through menopause, the most common symptoms they'll have are hot flashes or night sweats, but many times that's accompanied by mood or irritability issues, sleep issues, sexual issues such as vaginal dryness. And so they should be empowered to call their primary care provider, whether that's a family medicine doctor or an internal medicine doctor, and they can also talk to their OB/GYN doctor about managing these symptoms. What's nice about Mayo is that we are an enterprise, so we have a national presence at multiple different sites, so it allowed for us to really survey residents in different sites, although we did look out beyond Mayo Clinic at sites on both the East and the West Coast. But there's a lot of us that specialize in menopause medicine and are working with national organizations like the North American Menopause Society to further education initiatives and to help improve clinical practice so more women can get the care that they need. I think for patients, it's important to know that if you are having symptoms of menopause, that I encourage you to talk to your doctor. Because since the Women's Health Initiative, we've had a lot of research and analyses that has demonstrated the safety of hormone therapy for the treatment of the symptoms of menopause. And I think what this study shows us is that your doctors do care and want to know this information.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.